The Lorna M. Global Institute is rooted in equality and justice. We are committed to exploring innovative, non-traditional modalities and approaches to positively shift cultural norms relating to bias, hate, and disparities. Thank you for joining us today as we discuss the fierce urgency of this moment, a great moment for healing communications and bridging the divides within race, culture, faith, media, and politics. We must be the change we seek. Let's follow the compass of love for one another. Open our hearts and inspire the best in each of us, eliminating the virus of bigotry and confusion. Responding to the call of our moral compass for a more perfect union, I ask each and every one of you to join me in bridging the divide by sharing your bridge building ideas through the Lorna M. Global Institute Town Hall. The future is in our hands. Good afternoon, good evening, good morning, wherever you are around the globe. Welcome to the Lorna M. Global Institute Virtual Town Hall. You know what to do. Host a Facebook party, share with your family and friends, and most importantly, let us know your thoughts in the comment section. The nation looked on with hope as the first doses of COVID-19 vaccines were administered. The same day, we experienced over 300,000 deaths. Today, the US accounts for approximately 1 out of 5 COVID deaths worldwide, far more than any other country. According to the Associated Press, the number of dead rivals the population of St. Louis or Pittsburgh. It's equivalent to repeating a tragedy on the scale of Hurricane Katrina every day for 5.5 months. It's more like 5 times the number of Americans killed in the Vietnam War. And it's equal to a 9/11 attack every day for more than 100 days. Like millions of others across the globe, no one could have imagined nor prepared for nearly an entire year of quarantine. There are now hundreds and thousands of empty chairs at kitchen tables. We are witnessing families and small businesses that took generations to build vanish right in front of our eyes. And now we have a country that is bursting at the seams because of racial and economic divides. African Americans are dying at 2.5 times the rate of white Americans. Why? Statistics shows that people of color are disproportionately represented in what has been coined as essential work. These people tend to be one sustained in the public service industries and are more likely to be interfacing and infected persons through their work as healthcare workers, education, and childcare. We owe it to them to do our part. Whether we're delivering the mail, executing waste management services, driving taxis, buses, Uber or Lyft, or struggling to keep our families and small business afloat, the pressure of this pandemic are real. Many people across this country are having to make the critical decision between economic and health security and safety, especially those who come from marginalized communities. Recognizing this year is rapidly coming to a close, we here at LMJ Global found it fitting to use this, our last show of the season, to revisit a topic that isn't going away anytime soon: the pandemic of COVID-19 and its impact on our families, communities, and businesses. We are excited to be joined by a dynamic panel of experts, as well as hear from a very special guest, Congresswoman Barbara Lee. Congresswoman Barbara Lee, of course, cannot join us at the moment, but she will join in and we will let her in as soon as she's able to. But for now, we're going to start introducing you to some of the business experts in government and also medicine. So let's begin with Miss Natalie Cofield. Natalie Cofield is the founder and CEO of Global Women in Business Collective, Walker's Legacy. Natalie is heralded among the nation's most prominent diverse entrepreneurs. She has provided some of the nation's most prominent CEOs of billion-dollar organizations, executive of global brands, senior advisors to the White House, mayor of leading national cities, and community activists and leaders with inspiration, insight, and advice. She was named by Entrepreneur Magazine as one of the most powerful women in business in 2019 and selected among 137 cover story business leaders and entrepreneurs from across the nation for her response to the COVID-19 in the magazine most recent July-August 2020 edition cover. She has been named as a woman women's business and one of the 100 most powerful Washingtonian by the Washington Business Journal. Ladies and gentlemen, please welcome Natalie Cofield. Natalie, thank you for joining us.
Hi there. Thank you for having me.
Man, you are truly the definition of the boss lady. You know, your work in business is very impressive. Tell us a little bit about Walker's legacy and the inspiration that you found with Madame C.J. Walker.
Sure. Founded in 2010, Walker's Legacy is a national women's organization designed to inspire, equip, and engage the fastest growing entrepreneurial segment in the nation, which is multicultural women. We also have an adjoined nonprofit arm, which is the Walker's Legacy Foundation. Our organization exists in a 15-city footprint. We conduct entrepreneurship accelerator programs where since COVID, we've actually graduated more than 400 women, training them through 3 months of training on things to scale their business, to start their business, to grow their business, which is particularly important during a moment like this where we're seeing the pandemic having such massive impact on our economy and on small businesses within the economy. We do research as well. So we are leading right now the first ever research study on Black female entrepreneurship for the US. Doing this with funding from the Gates Foundation, trying to get a better understanding of exactly how COVID-19 has impacted and may impact further minority women, Black and brown women entrepreneurs. I know anecdotally people have said, 40% of Black businesses will not survive the COVID circumstance, but those were mostly numbers from May. And so this pandemic has lasted so much longer than any of us could have imagined and will continue to last longer than we probably foresee or want to admit. And so what does it mean for us when stimulus funds come, when corporations are making big donations or big commitments and pledges? What does it mean for us to use that data and that information to inform them on how to support, how to undergird, and how to work with the fastest growing entrepreneurial segment? And when I say that, Lorna, from the perspective of Black businesses, particularly, we're talking about Black women represent nearly 60%, 58.9% of all Black businesses in the United States are started and run by a Black woman. And so that's a pretty powerful figure, particularly because of the fact that we're the only community of women that over-index as it relates to entrepreneurship. So through our membership program with Walker's Legacy, through our summits, through our entrepreneurship training, through our entrepreneurship conferences, through our award ceremonies where we honor and highlight nearly 200 women a year across the country, everything from mayors of cities to women who are founding multi-million-dollar startup companies. We are on a mission to basically say, not only are we here, but we know we're here. We're here to support you, and we're here to uplift you and give you voice and platform in a time where it's so critical and important for us to have one.
You know, I too have the opportunity to be in the house and the estate of Madam C.J. Walker, and it was certainly an experience for me. I mean, I got to play her piano that they still preserve, the writing on the wall, it just being in the present, that atmosphere, that energy that she gave lived with me to this day. And when I learned that that's how you pattern your branding of her legacy, it was like goosebumps. It was like full circle. I mean, really, it was truly, truly impressive. I admire what you're doing, and I am truly grateful to be also in your presence, just as I was with Madam C.J. Walker. But we have to continue this conversation another time. For now, let's bring on my mayor, Mayor to the Stars, Mr. 90210, Mayor Friedman. Mayor Friedman was first elected to the Beverly Hills City Council in 2017. Previously, he served on the Beverly Hills Traffic and Parking Commission from 2011 to 2017 and was chair in 2015. He was also chair of the Beverly Hills Taxi Review Committee and served on the Blue Ribbon Commission for Santa Monica Boulevard reconstruction. He's a graduate of UCLA and attended Southwestern School of Law. He is husband to Simone Friedman, who was former chair and commissioner of the Recreation and Park Commission and also served as chairperson and president of the Beverly Hills Education Foundation. They have 4 children, Joshua, Alana, Adam, and Jeremy, and a daughter-in-law, Tanya.
Thank you
Mayor,
so much.
welcome.
Pleasure to be here.
So good to have you. Mayor Friedman, you know, the rise in COVID all over LA, we're now rising and one of the #1 in the country. Mayor Garcetti of LA has ordered the lockdown. How is that impacting the economy of Beverly Hills? And what do you think about shutting down completely? Or should we take it step by step? And I also want you to just give a little brief comment about the difference between the city and the county, because Mayor Garcetti is from LA and you're from the city of Beverly Hills. So in your answer, please give us a little background.
Sure, very good. Thank you for having me, and how inspiring, Natalie, to hear the work that Walker's Legacy does. Beverly Hills is a small community. We are surrounded by the city of Los Angeles and the city of West Hollywood. There are a total of 88 cities in the county of Los Angeles, and we are one of the counties of the state of California. In governance, the state of California, in terms of the regulations for the COVID pandemic, the state of California is the one who sets the general rules. A county or a city can be no less strict than the state. Following that, the county has its rules, and again, they can't be any less strict than the state of California. But we as a city can be no less strict than the county of Los Angeles. In fact, in the beginning of the COVID pandemic, we were more restrictive in certain areas, such as wearing facial coverings, than the county was. The county did catch up to us later on and put in a face covering requirement. But we were one of the first cities in the state of California to require that there be face coverings. In general, we all must now follow the state rules and the county rules. And we had an example of a problem fairly recently. And Lorna, I don't know if you want me to go into that or not. So the County of Los Angeles allowed outdoor dining in all of its cities, and there was no dining permitted indoors whatsoever. That went on for a couple of months, we helped our businesses in the area by allowing them to use the right-of-way, the sidewalk right-of-way, and the parking right-of-way so that they could build outdoor spaces. They did so, and in effect, that really helped the businesses, the restaurants and small retailers survive, certainly not making money, but survive and keep people employed. Then all of a sudden on, I think it was November 17th, the county came down and said, you must restrict the outdoor dining to 50%. The businesses did that. And then 5 days later, all of a sudden, the county came out with an edict that said no more outdoor dining. We as a city council felt that that was unfair. We passed a resolution, sent it to the county and said, please explain to us how it is that outdoor dining, when people are observing the spacing, wearing face coverings when they're not eating, how is that contributing to the pandemic? And the issue went to court. It went to the Superior Court, and the judge there also asked the county, what evidence do you have that the outdoor dining is contributing to the pandemic? The county could not come up with that. The judge gave them a week to come up with some information. They went back to court. And at that time, the county was unable to show that there was any correlation to the pandemic numbers going up and the outdoor dining. However, in between all of that, the state of California did come up with a stay-at-home order. So right now, the status in our city is that the county order is no longer going to be in effect. However, the state stay-at-home order is still in effect. And that's obviously had a significant effect on our businesses, both the essential retail, non-essential retail, and certainly our restaurants.
Okay, thank you, Mr. Mayor. Don't go anywhere. I have a shero in the room, and I'm going to bring her right on. And that's none other than Dr. Lenora Bullock.
Dr. Lenora Bullock is a medical doctor in Atlanta, Georgia, where she serves as a medical director of the Tidewater Baptist Association's Help for Haiti and Help for Kenya missions. She was recently elected as the next president of the Atlanta Medical Association. Dr. Bullock received her doctorate from Meharry Medical College. She specializes in emergency medicine and completed a residency at Emory University School of Medicine. A dedicated servant and healthcare professional, Dr. Bullock serves on many boards and takes pride in providing quality healthcare to people regardless of their ability to pay. As an emergency room physician, Dr. Bullock understands what it means to be on the front line at this time in our history. The emergency room department is the first point of entry to the hospital for COVID-19 patients. Ladies and gentlemen, let's honor one of our sheroes, straight out of Atlanta, Dr. Lenora Bullock.
Dr. Bullock, welcome, welcome. Thank you for all you do. I know you have your work cut out for you in many ways, more than one. Your hospital, like the one you're at in Atlanta, Georgia, are now in overload due to the pandemic. The hospital beds are limited. Medical personnel are exhausted and overwhelmed. What are some of the things that we can do to help? And how can we help you what message can you give to our community so that we can be a better support for the frontline workers?
Oh, thank you for that such kind introduction. I really appreciate it. And I want to thank you all for listening and taking the time out just to hear from me as an emergency physician, where we're on the front line and we're doing our best to take care of each of you. And we ask that at this point in time, there's such a health disparity in the African-American community. Well, I'd like to talk about the Atlanta Medical Association, which is ATL Med, where we've because there's such a health disparity, we've decided to create a website there. On our website, we have a link to Ask a Black Doctor, where we're addressing some of the issues that affect the Black community in general. And with the disparities in the coronavirus, this is very important. We've had several series on the coronavirus and regards to the elderly, in regards to just general information. And I'd like, if you all have time, you have questions, to check out atlmed.org and look at our coronavirus resources. And as far as being a physician, we're there for you, and we're going to do our best to take care of you. Where I know there's a lot of misinformation out there about the virus, but our goal is not to harm you. It's to do the best for you and to give you the best information that we have available to us, even though this virus is novel and we don't know as much as we would like to know, and things unfold every day. Our goal is to be honest and transparent with you so that we form trust with you and you can trust us to take care of you, because that's our basic goal, period.
What about the vaccines? We have heard so much about it in so little time. There are probably as many skeptics as interests. So now let's listen to what Dr. Kizzy has to say about that.
A Black woman from Orange County will go down in history for leading the effort to solve this global pandemic. Dr. Kesmikia Corbett with the National Institute of Health is on the front lines of working with a team of scientists studying Moderna's vaccine, one of the 2 COVID-19 vaccines shown to be effective by more than 90%. The drug expected to receive emergency use authorization by the FDA later this week.
I wanted to make it clear that the work that we've been doing for so long, I stand by it with essentially all of my being.
But Pew Research shows only 42% of Blacks are likely to get vaccinated, compared to 63% of Latinos and 61% of whites. One of the reasons, decades of abusive medical tactics on Blacks dating back to the Tuskegee syphilis experiment of 600 Black men.
I also understand that there are issues of lack of trustworthiness. And I say it in that way because understanding that the onus of gaining the public's trust lies in the hands of people like me.
That belief of gaining trust and bridging a path has always been with her since her days as a PhD student at UNC, according to Dr. Aravinda De Silva, Corbett's mentor and professor.
Even as a graduate student, she was very involved in promoting science, going to schools, speaking to groups that typically would not consider careers in science.
He says between 2009 and 2014, she studied the human antibody response to viruses, specifically dengue virus. Corbett even traveling to Asia for several months to study that virus. Now she and her team making history at the forefront of the novel coronavirus.
Well, I'm very proud, but I also knew that Kizzy would go on to do great things. She's very level-headed and can handle pressure well.
Dr. De Silva expects Corbett will continue her research with COVID-19 and find ways to get people of color interested in science. Right now, her industry is nearly 70% white, according to the National Science Foundation. Tim Pulliam, ABC 11, Eyewitness News.
We would love to hear what your thought is on that video and what Dr. Kizzy had to say.
I think with all of us participating, everyone who receives the vaccine, especially African American and Hispanic Americans and Native Americans, if we will use social media to show when we receive the vaccine and give days of follow-up after we receive the vaccine, I think that will increase the confidence that other African Americans and Hispanics have in the vaccine, because there's real reason for us to worry because of things that have happened to us in the past. And that's not lost on me. That's not lost on any African American health professional. We're a little nervous about taking the vaccine as well. We have to, I'm just being transparent. But at the same time, I realize that the studies have been performed very well. The evidence is there that it works. And the advantage that the general public has is that they will actually get to see us take the vaccine first. And before it becomes available to them, it will be a couple of months. And so you can monitor what happens to us. And then I think that will bring in some reassurance that this is a safe vaccine. But we have to really consider being vaccinated because we are dying at rates that are just unbelievable. And it's sad, and it's young people, and it's middle-aged people, and it's old people, but it's people that don't have to die. And we really have to really think about taking this vaccine.
In your professional opinion, and given we have the vaccine, how long can we expect before we can come back to any sense of normalcy, to this new normal that we will have to endure?
I really do think a couple of years, because the first rollout for the vaccine is now for healthcare workers. And I still have not received my vaccine. I should be receiving it hopefully within a month or so. But first, we have to get through the first line workers. Then there'll be a second phase where we will be doing most likely police officers and people who are also highly exposed before it gets to the general public. And by that time, it may be April, there may be some delays. It may actually be March or so, but we have to get at least 70% of the nation immunized before we have herd immunity. So that will take much longer than a year, because even after you receive the vaccine comes in 2 doses. The 2 vaccines that we have now come in 2 doses, but after there's almost a month delay from the first dose to the second dose. And then there's still with one, there's 7 days before you're actually immune after the last dose. And then the second one, there's about 14 days before immunity actually will kick in. So, I mean, but this is very hopeful because there is something that we can look forward to in terms of getting back to normalcy because it would take much longer with herd immunity. Because I think right now, maybe about 15% of the population may have been infected, but we need at least 70% to have been exposed and have antibodies.
You know, it's interesting that you say you would take it openly in the public eyes. Do you think that's any effect? Because what I've heard and what you're hearing on the street is that it doesn't matter if you take it in front of me, because I really don't know what's in that bottle. So if you're talking to the real skeptic, you know, you wonder, is that a way to do it? Because whether or not you take it in front of them, if they don't believe, they're just not going to believe.
Right. There are some people that will not be convinced no matter what. But I think that there's the general public is just more interested in seeing what will the effects be. And I think by chronicling the actually taking the dose and days afterwards, how I feel, what's going on, and I plan to do that on social media once I get the vaccine, then I think that it should build confidence in some people. You're not going to win everybody, but if we can win most people over to get the vaccine and we can save lives, then it's worth it.
UCLA this morning, I think, rolled out their vaccination program. I know there are several surrounding hospitals. You have a few surrounding hospitals around the Beverly Hills area. You mentioned about waiting our turns. What kind of procedure do they have in place? And how do they decide who are getting these vaccines? Are they using the standard, or what are we doing here in California?
Well, the other hospital that is close by is Cedars-Sinai, and Cedars-Sinai is also one of the distribution points, as is UCLA, for vaccinations in Southern California. The governor has set forth a phasing of the vaccines, and in phase 1A, the healthcare workers and residents of long care facilities will be the first ones to be vaccinated. Then goes to phase 1A after that, which is acute care, psychiatric and correctional facilities and hospitals, skilled nursing facilities, paramedics, EMTs, and others providing emergency medical services, as well as in dialysis centers. And then goes to intermediate care facilities, home health care, in-care supportive services. So as you can see, as it goes down the line, what they are going to do is distribute to the most vulnerable populations before it gets into regular usage. Like Dr. Bullock, I have a son who is a physician, and he is at Cedars-Sinai, and he is experiencing the fact that they're down to less than 10% available occupancy for ICU beds. So it's a real crisis, and we do need to get ahead of this quickly. But it does not seem that the general populace is going to get the vaccinations until at least March or April, if at that time. And that we do have a ways, and everybody needs to wait in turn so that the most vulnerable are the ones that are inoculated first.
That's awesome. Just, thank you for what you're doing. But now we're going to go turn back to some business as to how the COVID will now interact with business. So Natalie, let's talk about the recovery. How do you think after going through all this trauma, are we going to come back a stronger economy, or and what time period do you think it's going to be before we'll be able to bounce back, if and when we do? It's America, so I'm sure we will at some point, but
one of the things that I think COVID has demonstrated to the U.S. economy is the vulnerability that we had as related to our supply chain. And when you think about the idea of bringing back manufacturing to our country and how critical and important that is, at the beginning of the shutdown, we realized that there were a number of things that we couldn't get anymore. And we couldn't get them because we didn't make them in the United States of America. We couldn't get them because they were being shipped from other countries into the U.S., parts, pieces, or the entire product. And it demonstrated the vulnerability of our economy. My hope is that when we come back to where we aim to be, which is at a more robust economy than the one we left prior to COVID, that we really put the support resources and funds behind bringing back more manufacturing jobs and bringing back jobs that pertain to blue collar work. We also have seen just how much we depend on blue collar workers in this country. And I think we need to have a conversation on what it means to support them, to support the businesses that surround the blue collar economy. Because quite frankly, in addition to our medical professionals, the blue collar community was the overall hero as well of how we have been able to survive as a community through COVID. And so I think what we're going to see is a lot more innovation around how things will be delivered. I think we would be very much so short-sighted to think that once we get back to a kind of post-COVID as normal life, that it's going to look exactly the same as it did before we experienced COVID. It won't. There are going to be elements and aspects of what we're doing now that we're going to incorporate into our everyday life, and businesses that want to thrive and grow will be learning what was working now, what they can improve on, how this is potentially creating price efficiency for them, and how they may be able to integrate that into what they move forward with. But yes, the hope is that we go back to a strong and stable economy. But we've got to get America back to work. We've got to get America back supporting work and businesses in order to make that happen. And the last thing I'll say here is that the restaurant industry is going to forever be changed by COVID. And I think the way that we experience entertainment, the way that we experience dining is going to, I'm actually excited about what it might look like, because I think that there are a lot of things that restaurateurs learned about exposure points for them during this very unfortunate moment that we're all living through, that they have the potential to really build some innovative business models around. And I look forward to dining at some restaurants that are kind of integrating a post-COVID moment.
Natalie, you advise a wide range of clients from the very wealthy to the little guys struggling. Were you involved in advising any of the current administration? And what are you telling your clients? And what are you telling them in terms of the business, about their economic future as you see it?
So Walker's Legacy and has worked with, and I personally have worked around championing the mission of entrepreneurship and economic activity across a myriad of different administrations. And so there were conversations that we have had there, conversations that we intend to have in other spaces. But I think the most important thing is, what are we as an organization doing? And what we're doing is we're collecting the data. We are training women, teaching them about skills to grow and expand their businesses. We are providing women with micro grants. We are part of the U.S. Chamber of Commerce's Coalition to Back Black Businesses, where we are responsible for awarding $10 million in funds to Black businesses over the course of the next 4 years. Since we launched the coalition late this summer, we have awarded 600 Black businesses with micro grant funding to support their endeavors. This is to me, getting businesses the capital that they need, getting businesses the tools that they need in the middle of a pandemic is and should be a bipartisan issue. That's the way we at least treat it. We want to understand what our community needs. We want to advocate for our community. And most importantly, we want to do the work around supporting our community. And that's exactly what Walker's Legacy is doing.
You know, Beverly Hills, Rodeo Drive was used to be, you know, this main street that everybody just excited about. This is Christmas time. There'd be cars driving. It would be crowded. People are not even sure that there isn't, you know, we talk about 90210. They don't even know that it's a real address. But, you know, people come to shop and do all these wonderful things downtown Beverly Hills. How are you impacted now that we are on a shutdown? And do you think that we should close everything down and hopefully have this virus go away and then open back up? Or do you think we should take it in small steps?
Well, you know, it's the health crisis is real. It's out there. And unfortunately, in my opinion, we didn't have the leadership from the federal government that we should have had in the very beginning. I think that there have been a consistent message from our federal government, which was the same as what our cities and states were doing, certainly in California. I think we would have been a lot further along than we are now, but we are where we are. California is recognizing a significant cutback in the amount of traffic that any retail store can have. Essential businesses are limited to 35% occupancy. That means a store must monitor the people going into it, and they can have no more than 35% of what the former capacity was. Non-essential retail is limited to 20% capacity, and that would be your retail stores similar to the ones that are on Rodeo Drive. So there is a significant economic impact that everyone is experiencing also. It is my feeling that if everyone would follow the rules, the social distancing, the wearing of face coverings, I think that we could leave the businesses certainly at the levels we are right now. But it's only if everybody would cooperate and do that.
Well, I just want to thank each and every one of you. This has been an amazing, impactful conversation. But before we go, is there anything that any of you would like to share with the audience about whether it's connecting with you or word of wisdom, anything that you want to share? It's a holiday time. What would you like to share with the audience? It might be the holiday, but we're not done with the election yet. And I wouldn't be Lorna if I didn't throw just a little bit of politics in the mix. Dr. Bullock, what do you tell voters of Georgia who are risking it all to make their voices heard in the upcoming election?
First, I'd like to wish you all a happy holidays. And I would like to encourage everyone in Georgia to get out and vote because it really matters this time. What we do in Georgia this time around will affect the rest of the nation. And as Natalie has stated, that we have essential workers and those people are disenfranchised. And I see a lot of them in the emergency room, the people that are getting us our packages through Amazon, the people that are working in the warehouse, the construction workers. And we need healthcare to be available to these people because they are essential. And whether they work in trucking or what have you, just being a person, they're essential to their family. They're essential to their mom, their dad, their children. So we really have to get out and vote because this election really matters in Georgia. So please, on January 5th or before early voting, please get out and vote. And in addition, please wear your mask. Please practice laughter. Please get outside and take vitamin D. Thank you.
Right, all right. The doctor's voter. There we go. Natalie?
Sure. I'll just say support. Happy holidays to all, and make sure you support your local businesses. Businesses can be supported through money order. I'm sorry, doing these kind of cards with restaurants where you're helping to invest into the future of the restaurant. You can do holiday shopping with small businesses online, whether they be in your community or not. But these are the companies that really need our support and to be undergirded. I think this is the year that possibly we might scale back on some of our more fashion brands and designer brands and really take the time to invest in what it's going to take for our economy to come back. I'd also just like to say that Walker's Legacy as an organization is excited about our membership and growing our membership across the country. And as such, understanding the times, we're very excited to have a free membership for new members throughout the month of December. And you can go to our website, www.walkerslegacy.com, to learn more about how to get connected there. And that's our holiday gift to you.
Great. I am looking forward to that. I'll be the first one to sign up. Thank you so very much. Very informative. And Mayor, you get to close us out.
Well, thank you. Thank you. It's been a pleasure being with all of you, being able to discuss where we are right now. Just a point of interest that the city of Beverly Hills is known for its luxury, for Rodeo Drive. But interestingly enough, 60% of our residents live in multifamily residences such as duplexes and apartment buildings. So there has been a significant effect upon our community, both residential and business-wise, as a result of this pandemic. And I will also say that we should support small businesses. Small businesses must thrive in order for our economy to be robust. I think that we have seen how the term that we've coined, essential workers, are really all of us. I mean, I know that I started my career when I was in college. I worked in a supermarket. As a matter of fact, I worked in a supermarket for many years, and that's hard work. And even just expressing gratitude to those people that you meet in the supermarket or in any service industry goes a long way, because the wages are not terrific for people in those blue collar jobs. So please respect them, be kind to them, and let us support all businesses so that we can get through this pandemic and get on to better times.
This is a peculiar time in our country. 2 days ago, we began the first distribution of the COVID-19 vaccine in the US. Our new president-elect, Joe Biden, and Vice President-elect, Kamala Harris, were confirmed by the Electoral College. And we are days away from celebrating the holidays with family and friends. Thank goodness we have a vaccine that is giving us some hope. We watched as a nation as the vaccine being administered to our essential and frontline workers who are saving our country, our lives, and our families' lives. It is time that we do our part. Let's do all we can to keep ourselves, our families, and our country safe. We have the power to end this pandemic. Let's wear a mask, wash your hands, and maintain the proper social distancing. If not for yourselves, at least for the one you love. Let's show the love and share our love by doing the right thing, protecting ourselves. On behalf of the LMJ Global Institute, we would like to thank each and every one of you on the front line. All you healthcare workers, all you essential workers, for your sacrifice during these trying times. Thank you all for joining us today. We'll see you in the new year. Stay safe, protect yourself, protect your loved one. Happy holidays to everyone. Stay safe. God bless. Good night.